Hi everyone. Uh, you guys can hear me? Yeah, perfect. So good afternoon. I hope everyone is having a great couple of days at the conference. I wanted to start by saying a big thank you to the Global Women's Health Innovation Conference for having us here and giving us the opportunity to talk about what we're building and being a part of the conversation. It's truly inspiring and encouraging to be in a room full of people that are interested in, passionate about working towards the improvement, innovation of women's healthcare and overall healthcare in general. Women's health is not a niche. And I think most of you sitting in this room today already know that. Women are 50% of the general population. However, I thought we could, start this session by sharing a bit of data, some stats about the space we're building in, which is the family building journey, to further contextualize what we're doing at Hum and why we're doing it. So essentially, 25 million babies are born in India each year. Out of that, 73% of families in India cannot access primary forms of healthcare due to lack of affordability. 31% of women in urban India and only 16% of women in rural India receive the full antenatal care they truly need. Antenatal care here is defined as pregnant and postnatal healthcare, which could include medical and non-medical forms of healthcare. Over 70% of women in the active workforce quit working by the age of 32, either have a child, raise a child, or start planning for a family. Postpartum depression and postpartum anxiety are very big factors in one's parenthood experience. Mental health is something that is extremely stigmatized until today in our country, and just because it's intangible, people think it's not relevant to talk about. 25% of women in India experience postpartum depression, 75% of women in India experience postpartum anxiety. But this isn't a woman's problem alone. It is actually a lesser known fact, but 8 to 10% of men experience postpartum depression, symptoms of postpartum anxiety, psychosis, and guilt. Post the pandemic, we've actually seen a sharp decline in the number of women in the workforce today. Different stages through the family building journey have a significant impact on one's physical, mental, emotional states of well-being. And despite significant innovation, progress, improvement in policy making, there are millions and millions of people in India that still suffer with struggles through their fertility journey, family planning, pregnancy, postpartum care, and parenthood in general. So what brought us here today? I started this space, and my journey is a bit atypical, I would say. I'm not a doctor, and I'm not an expert. I'm not even a parent, actually. But my interest sparked for women's health and this space in general about 15 years ago. Today, a lot of women here spoke about their PCOS experience, which was really admirable to see the confidence that they shared their experience with. I was actually one of those people. When I was 13, I was also diagnosed with different issues related to women's health, PCOS being one of them. And I remember the entire space being super hush-hush, quiet, stigmatized, lack of clarity, not knowing which doctor I could go to, going to a doctor, being given the wrong medicine, feeling like I can't talk to my friends about it, when essentially 1 in 5 women go through the same thing that I was going through. So my interest in the space actually started when I was a young teenager. Cut to, 2020. Sorry, a little earlier than 2020. Post-university, I returned. I was working in India. And simultaneously, I was spending time doing research about the space, women's health, health equity, healthcare in general. And I interviewed about 350 experts at the time. Sorry, 350 parents. Excuse me, I'm a bit nervous if I'm fumbling a little bit. So I interviewed 350 mothers, couples, and parents at the time, and got in touch with a little over 40 experts as well. What I learned in the space was that there were several problems women, parents, couples had in their family building journey. There were a lot of gaps in the market, and the products that were out there were not solving the problems that the people actually had. Cut to 2020, the pandemic. I think our country and the world actually experienced a lot. If you guys remember, healthcare in India, the healthcare system was completely overloaded at the time. Misinformation was spreading like wildfire. WhatsApp University was honestly the bane of everyone's existence, and wrong news, wrong information was spreading in a matter of minutes globally. I, at the time, had a friend who was expecting a baby, and she was absolutely terrified about when she could go get an ultrasound, what would happen to her baby if she got COVID, could she breastfeed her baby after she got COVID, could she get vaccinated, what would the vaccine mean for her baby. So essentially, at that time, I knew we had to build something and build something really, really fast. We needed to be a part of the solution and find a way to help people, number one, feel more secure, number two, get access to verified information they really, truly needed and deserved. So that was how our beta version called Baby Space started. It was a very simple web application that consisted of content and a community for people. We had then about 30 doctors that were working with us across different domains, from obgyn care, pediatric care, psychiatry, lactation, nutrition experts in all of these spaces. Baby Space was actually well received. We grew to a platform of 15,000 people in a matter of a few months. People got a chance to talk to each other anonymously if they preferred, got answers from experts in a matter of an hour when they couldn't actually get in touch with their personal doctor. With our community at Baby Space, we also conducted a study of about 640 parents, couples, mothers, those trying to have a baby or recently having conceived. We learned a lot from them. Essentially, this validated our idea for our product now, and it gave us, the information we needed to build our product exactly the way people really, really need it. Which brings us to HumCare today. Sorry for a very long experience and story about our journey and how we got here. HumCare is a digital healthcare app that offers affordable, personalized, high-quality, and curriculum-based medical and non-medical care for anyone and everyone in their family-building journey. Essentially, we work with mothers, families, and organizations to provide maternal benefits, employee benefits for their employees. I would say, maternal benefits is essentially a very westernized concept. It's something that is pretty prominent in the US and the UK. It's something very less known, not even considered today. But HumCare is definitely trying to make a difference in that. Before we get into that, super quickly, our belief at HumCare and our thesis is that healthcare needs to be guided. It needs to be driven by incentive, ideas, and understanding and empathizing with the user. In India, while telemedicine, technology-enabled companies have existed for a little over a decade, healthcare in India generally is pretty dispersed, independent, not integrated, not comprehensive. A user is essentially supposed to figure out how they're feeling and which doctor they should go to for that. Our approach is a little different. Essentially, we've built out a robust set of protocols, curriculum-based programs for the entire family building journey. So varied programs as well as specific. Essentially, we offer programs in postpartum care, postnatal care, newborn care, breastfeeding, lactation, weaning journeys, fertility planning, intimacy, conversations, building a relationship with your partner, your family, return to work, and then, of course, the more medical side of things, which is obgyn care, pediatric care, psychiatry, etc. So this is a super text-heavy family building slide. Essentially, we kept it that way to show you the details and how deep and how convoluted, complex the family building journey truly is. At Hum, we divide the family building journey into 5 different stages. The fertility and family building stage, the pregnancy stage, the postpartum and newborn care stage, the back to work transition stage, and then the overall parenting stage. Each and every stage has different facets, different aspects that affect your emotional, mental, and physical states that require both medical intervention as well as non-medical lifestyle-oriented care. Essentially, we identified through our research with BabySpace, through the study we conducted, that the postpartum, postnatal stage is the one that is the most neglected. It's actually called the 4th trimester by a lot of gynecologists, but it's something that no one actually pays any attention to. Once the mother gives birth to the baby, essentially all the attention goes to the baby. Everyone is only obsessing about how well the baby is growing, how well the baby is doing. But what's happening to the mother, her mental health, her mental care is, completely just not considered. With saying that, I'm going to bring on Dr. Amey Parekh, who will be sharing a little bit more on the mental health and the intangible parts of family building.
Thank you, Karina. So I think mental health is something that is under stress, but is slowly gaining its importance. Now, your mental health is related to your emotional health, your psychological health, your social health. And when we talk about it, we are looking at how you feel, how you think, how you behave. So essentially, when you're talking about mental health for women, or in case even for the men, postnatal, we are looking at a holistic approach to understand what they are going through, how they're behaving with their child, how they're raising themselves, and the relationship modification, the dynamics that's changing all throughout. So we at Hum, that's what we work at. We look at understanding all these stages that the woman and the man and the entire family is going through, how they're going to connect with the child, how we can improve the relationship that they have with themselves and with the child, and ultimately be happy when they go back to their routine lives. It's going to be a lot of change, and that's what we look at. So when we talk about mental health, especially in postnatal case, we see postpartum depression and postpartum anxieties gradually actually coming to awareness. It's not that it never existed, it existed all the time, but it was sort of a neglected scene. In the Indian typical household, we would see that the woman's given birth and the entire family is just coming and looking out at what the baby is doing, how is the baby eating, all of this, like Karina just said. But what if the woman's actually not able to connect with the child? What if she's constantly feeling fatigue, or she's feeling that she's not able to feel healthy anymore? She's having sleepless nights. She's showing signs of irritability. She's having fights with her husband and nobody in the family knows about it. And the husband's just shouting and ending it up. How many times have you heard this? Well, this is nothing but mental health that we're talking about. And this is not spoken for. Now, up to 2 weeks to even 6 weeks, we experience the baby blues. Okay, that's normal. We understand that the woman's experienced a huge change in her life. She's going through a lot of hormonal change. But what after that? Even up to a year, a woman may experience all these kind of changes, sleepless nights, not being able to eat, not able to connect with people anymore, not even able to connect with a child. If she's experiencing cases of anxiety, she may be having actual physical symptoms. She may be experiencing palpitations. She may be having, difficulty in eating. All these things we see. But how many of us really understand that it's not anything else, but it's in our mind, and that's what's causing the problem. So that's where mental health comes in picture. That's why we stress on understanding a holistic approach. And when we look at it, we cover all of this. Plus, we look at even the relationship that the husband and the wife undergo. Because there is going to be change in dynamics. It's not going to be the same. It's not going to be the same when they go back to work. It's not going to be the same on the very next day when the child's come in the house, because suddenly all the attentions change. There's all these expectations that are put in without even realizing it. And how many of us realize this is all unspoken? Nobody really talks about it. It's just understood this is going to happen. So this is where we at Hum understand and we work towards improving the mental health for each and everyone. Even during the journey of the pregnancy, the women, the man are prepared for these possible changes and what needs to be done. Karina, do you want to add something?
Yes. Wanted to quickly ask you if you could share a little bit more on the relationship changes post-baby, how men also experience certain, issues related to mental health as well.
So I think one of the things which a lot of people get surprised hearing is that the men are also affected by the baby. Men are not prepared. Let's be very honest. Men are not prepared. They don't know how it's going to be, when they have the child in their hand, how the fact that they used to spend that intimate moments with their wife is going to be affected because there's another person in the room, right? So it changes. The way they thought things would work, it doesn't work anymore. A lot of fathers are not even able to connect with the child because they don't understand what to do. They don't even know how to lift a baby. I mean, come on, in the Indian population, how many boys have actually lifted a child? It doesn't happen. And then they start seeing these problems. They start getting irritable. They start having these mood changes. They feel that, I'm not getting the attention I used to get. I had these demands, now they're not getting fulfilled. Suddenly the baby is having everything. They want the wife's attention, they're not getting that. And all of this actually causes even change, that can result even in depression in men. And that is proven, and 8 to 10% of men experience this. The relationship changes between the husband and wife. There is no longer that dynamic which they thought they used to have, because of that introduction of a third individual. It's essentially a third person in a dynamic of a family. So when we have to understand these changes are real, and talking about it, getting the right help, getting the right counseling prepares you for these changes to tackle them in the right way. That's what we do at Hum.
Perfect. Thank you, Doctor. I wanted to quickly touch upon what our programs consist of and what they focus on. So every single program we built at Hum has been built with an expert or a doctor in their specific field. While we have general programs, we have super specific programs. Subscribing and a subscription to a healthcare program is, again, a very westernized concept we're actually trying to bring into India, especially because we believe in the continuum of care. A continuum of care through the antenatal and prenatal, postnatal, and obviously the pregnancy stage is absolutely critical to the mother's health and the newborn baby's health. UNICEF acknowledges and recognizes the first 1,000 days from the day the woman conceives and is pregnant until the second birthday of a baby as the most important period in the entire parenthood stage. They say that the first 1,000 days are the most formative and play the biggest role in the development of a baby and the development of the mother after her new normal. And yes, we do look at, post-pregnancy as the new normal because your life has completely changed in every single way. Here again, what our programs consist of are one-on-one consultations, one-on-one chat with in-house care companions, CAPA-certified doulas. Again, something that is new in India, but they are essentially birth educators, care educators that help you during your pregnancy and post-pregnancy stage. We've built lessons that are bite-sized pieces of content that have been built with doctors, one of them being Dr. Amey Parekh, that essentially help you kind of understand, stay fully informed, and essentially become independent. And that is our aim at Hum. While we do want to be part of the continuum of care and be with you through months and years of your parenthood, we also want you to build your life, be independent, stay fully informed before you make decisions for yourself or your little one or your family. This essentially brings us to, the last part, something I'm truly, truly passionate about personally as well. In general, I think we all know that the gender equity ratio when it comes to the workforce in India is completely unequal. We have definitely struggled with having women in the workforce, having more women in the workforce, and post the pandemic, there's been a huge decline that has made headlines on many fronts. What we recognize and we're very cognizant of at Hum is that it is not healthcare alone that can bring more women into the workforce. We need employers, we need those in leadership positions, CXOs, managers to really be part of the conversation. Number one, to be sensitive and empathetic to what their employees are going through, whether it is financial struggles due to an IVF treatment, egg freezing, emotional struggles with miscarriage, trying to empathize with their working woman who is pregnant and she's dealing with morning sickness, a new mom who has come back to the workplace and trying to figure out her breastfeeding, her weaning journey, really figuring out how she fits in back with the team, how she's doing mentally, feeling guilty leaving her baby at home, essentially, or there are single parents actually in the workplace that also struggle. So what we built at Hum is something that we like to call our HERE framework. HERE stands for Hum Expecting and Returning Employees, where we work with the leadership teams, the CXOs, the managers essentially to provide a framework and help them build policies, help build sensitivity in the workplace, empathy, team dynamics, essentially to bring back more women back to work after they leave on maternity leave, bring back women to work after they're new parents. And essentially here we look at things such as managing bias, policies, conversation, understanding that the leadership goal is the same as the employee. And in turn, our aim is to reduce attrition, increase retention, and bring more women back to work. So with saying that, I wanted to quickly conclude. At Hum, we are extremely passionate about what we're building. We are very, very eager to learn from our users, from the companies we work with, from different families on our platform, and keep iterating and building our product really according to people's needs. To quickly touch upon the conversation earlier, data is so, so important. Our platform is encrypted. All data is encrypted for organizations. Some is doubly encrypted. We do not sell data. Our consumers are extremely, extremely important and the center of everything we do. So I just wanted to conclude with that. And if anyone has any questions for me or Dr. Amey, happy to answer that for you. Thanks.
A huge round of applause, ladies and gentlemen. Do we have any questions? Yes.
You can try without the mic.
In India, when two people get married, they often say the families are getting married. Similarly, when, after giving birth, the extended family really gets involved, right? So, what role you think tradition plays, Indian tradition, especially with the last, which has been going on for thousands of years. And, sometimes they say that there are Indian traditions around this for a scientific reason. And because the extended family has to get involved, at least I think for another generation or so, there will always be this debate that, should you follow guidelines or, apps like yours, or, communities or guidelines like yours versus what the Indian tradition is saying. So do you have plans to, incorporate this, or have you come across feedback from your users where they're having this conflict between trying to stay true to their tradition? Because you cannot just tell your family, I'm not going to listen to you anymore, right? I'm going to go my own way. So this is a very sensitive issue for Indian families.
Yeah, absolutely. I couldn't agree more, actually. We are not trying to replace tradition. While we are a modern healthcare company with scientifically backed information, data, processes, our aim is to provide that second opinion and piece of advice. So tradition is very important. It's what binds us to our legacy, what binds us to history, and our families, our forefathers, etc. But for us, we definitely only put up scientifically backed information. So I'll give you a little example, or two of them, actually. One of them, a question we get asked a lot. It is commonly advised by Indian practice that a pregnant woman should eat one laddu every single day as she's pregnant. It's another common practice that a pregnant woman needs to keep gaining weight and eat meals for two. That is absolutely scientifically, factually, medically incorrect. A mother, a pregnant woman, is essentially meant to only eat 350 calories surplus, and that is sufficient for her and her baby. So essentially, while these kind of thoughts and traditions are used by many, our aim is to give you that second scientifically backed alternative. We're not trying to replace what your mom is saying or your mom-in-law is saying, but we want your mom-in-law and your mom to come in on the app and make it a family conversation. So group therapy is actually something that's very big on our platform. Couples therapy is something Dr. Amey Parekh does as well. We are not trying to exclude anyone's parents, anyone's family, because of course, everyone wants to be part of this very exciting journey. So that's essentially our take on it. While tradition is very, very important, we can never, underestimate the importance of science and modern healthcare and adapting to the new technology. Yeah.
Yeah, navigating to the microphone, I think, is one of the key areas. Anyway, it's a fabulous presentation that you put together, but there are a couple of observations and some questions. One is, this entire space of, pregnancy and everything around it, I think, in my opinion, is already very crowded.
Correct.
And a lot has been done already in that space, involving the partner, involving the families, very specialized sort of therapies, if I may use the word, like lactation, baby care, mental health, postpartum depression, and so on. So I think people are already doing a lot in that space. While I understand that a lot needs to be done and make it more mainstream, perhaps in smaller towns and rural India and so on, I'm not taking away the importance, but I'm only saying that a lot is already happening. Today, much of this is already mainstream. Some of the things that you already mentioned, that this one laddu or so many calories, eating for two, I think it's been demystified quite a bit already. But yes, a lot needs to be done, and I don't disagree. So my question is, how are you different from the others that are already there? And is there some form of integrative sort of thing that you're doing with the medical fraternity, with the other specialists, or some such thing? Or whether this is another offering in a Xylo, and if it is, then what is the key differentiator?
Great question. So I actually agree with you. I think there have been a lot of attempts, but no execution in this space. I think content and community has been the forefront of pregnancy and maternal health. However, a more active approach is most definitely lacking. A more affordable approach is also lacking. Why we're different is because we're a B2B company first. Essentially, maternal benefits have never happened in India before. So we're actually working with a few Fortune 500 companies, which we'll be announcing in January as a first of its kind for employees. Essentially, while content and community is prevalent, a curriculum-based, scientifically backed curriculum full of consultations one-on-one, as well as chat with doulas, again, a westernized concept, is something that has not happened yet. So our kind of thesis and our approach in this space is focusing on B2B first, scaling our product, reaching a significant amount of people in the workforce in Tier 1 and Tier 2 India. And then we do plan to bring our costs down and offering our product full-fledgedly B2C. But while there is awareness and content and information, the problem is still glaring. We still have, most of India in rural India that don't have access to the healthcare companies, don't even understand community. And something we learned with the beta version with BabySpace was that communities don't work in India. A concept of a community and having a place where you ask questions Indians don't actually want that. That's again a very Western concept. People are more comfortable sharing and giving advice and opinions and putting their name against, a personal problem they're facing. But what we learned from our community of 15,000 people is they wanted one-on-one privacy. They wanted access to someone who is taking them through everything, whether it is a weaning program and figuring out how I can wean off breastfeeding my baby so I can go to work in 5 months from the day I deliver, or 4 months from the day I deliver. They need a care companion who helps them through their OB-GYN journey, postnatal checkups, a therapist, a life coach. So our approach is a little more active, I would say, than what's currently out there. And why we're different is because we are also a maternity benefit and employee family benefit company.